Good morning, Dr. Schottenstein. So tell us about yourself, your journey, your business, and the team. First, let's talk about your personal and professional journey.
I grew up in Ohio, and when you become a physician, you go through multiple different graduate university programs. So for me, I started at Michigan, then I went to Ohio State, then I went to Emory, then I went to Columbia. Then I started working in New York in about '05, and then started my own practice around '09. I did a neurology residency and a anesthesiology fellowship, so it's a good combination to have for the field of interventional pain management.
Tell us about your expertise and experience in the field.
Most of what pain management is spine, because spine is the most typical cause of chronic pain in our country. Usually the low back, sometimes the neck. The nerves run through the spine the way shoelaces run through a shoe. So to have an orthopedic training in pain management and a neurologic training in neurology residency, it just brings the spine together so that you have both very important parts, the neurologic part and the orthopedic part, accounted for.
What would you consider your key milestones and notable achievements?
I think every doctor feels that getting board certified is the crowning achievement. It's sort of considered mandatory, but it's still considered a great achievement. So being board certified in neurology is very difficult, and then being board certified in pain management is difficult, but less difficult because it's a subspecialty, and being board certified in both is very unique. I think there are only 250 doctors in the country board certified in both.
What values that guide your work?
Well, I became much more focused about 5 years ago on just having individual one-on-one interactions with patients and no more intermediary staff to theoretically complicate or pollute the conversation even inadvertently. So taking care of people is the goal. Taking away any hindrances to communication is also the goal. So when patients come in here now, I talk to them one-on-one without any assistants or intermediaries. I find out what the problem is and I figure out how to help people as best I can. And it becomes very simple at that point. I'm here to provide a service of helping people as best I can. And I think as long as we keep that in mind, everything's great.
What's your practice stands for?
People come in pain. I want them to feel better when they're here and when they leave. So my practice stands for making people feel comfortable, making people happy, both with the treatments they receive and with how they interact with me. I want to bring them up, make them feel good. I want this to be a nice place where they can always know they're going to be feeling good, both by the interactions with me and by the treatments that we provide.
So you've answered the question, but lastly, what sets you apart from others?
I think the double board certification in neurology and pain management is very unique, and it's not just on paper, it actually gives me the expertise of both areas, which is unusual. And then just the, like I was saying, the one-on-one interactions with the patients. I do all the consultations, follow-ups myself, I do all the procedures myself, and I don't let any intermediaries or assistants, even if they're well-meaning, interact with the patients while the patients are in the office, because again, I don't want anything to be complicated from the interaction that I have with the patient.
Thank you very much, Doctor. Thanks a lot.
Thank you.